Master C.V.V. Namaskaram to your lotus feet. నాలోన కలవెల్గున పరిసరముల వారి రూపమున కనపట్టుగాక నాయుచరించడి నాదమా వెల్గుగా వినిపించి కనిపించి వెలయుగాక నాలోన వెలుపల ఏలు నిశ్శబ్దంబు ప్రేమగా సాక్షాత్కరించుగాక మా కంఠ శబ్దాల చీకట్లు వెల్గుగా కరగించి అది మమ్ము కలుపుగాక తెలివికిని సద్గుణముల బలము గూర్చి నా ప్రణాళిక విశ్వ ప్రణాళిక గను వ్యాప్తమై విశ్వమూర్తి రూపంబునందు నిలుచుగావుత శాశ్వత నిలయమగుచు. నమస్కారం మాస్టర్ E.K. Good morning to everybody. In the previous classes, we learnt about the useful drugs to treat the patients who are suffering with meningitis, depending upon the symptoms of the patients. Today, we will proceed further and try to learn the remaining remedies which are useful in meningitis treatment. After that, we will start a new topic, sunstroke. Listen to me carefully. One of the useful drugs to treat meningitis patients is opium. Opium is indicated when there is intense headache, pain and stiffness of neck, projectile vomitings, severe constipation, and fever above 104 degrees Fahrenheit. Eyes of the patient will be fiery red. Patient feels drowsy but cannot sleep. Though the patient is suffering a lot, when asked, he will say that he is good. When fever is high, the degree of drowsiness will also be high. If we wake him up and ask about his health, he will answer in just one syllable and then goes into stupor. If it is characteristic that though there are warm sweats, fever does not recede at all. When these symptoms are present, one dose of opium 200c should be given as the remedy. If required, a second dose can be given in the same potency after 24 hours. If fever is more than 103 degrees Fahrenheit and the patient is more drowsy and stuporous, we should give one dose of opium 1 mg as the remedy. From the next day onwards, ferrum phos 6x should be given as follow-up twice a day for 3 or 4 days. Lycopodium, severe headache, increased pressure in skull due to headache, swollen eyes, pain in neck muscles, fever, suffocation and breathlessness, blue face and blue lips, aggravation of all these symptoms in sleep and after waking up indicate Lycopodium in meningitis treatment. The patient will have frightening dreams. Headache starts on the left side. The patient shows signs of delirium and speaks. He feels as if he is dead. When these symptoms are present, one dose of Lycopodium 1 mg should be given as the remedy. From the next day onwards, ferrum phos 6x should be given as follow-up twice a day for 3 or 4 days. Lycopodium. This remedy is indicated by fever, weakness, swelling of face, hands and legs, nausea, sore vomitings, abdominal distension, lack of appetite, and aggravation of all the symptoms between 4 p.m. and 9 p.m. When the symptoms are present, one dose of Lycopodium 200c should be given as the remedy. If required, a second dose of Lycopodium 200C can be given after 48 hours. From the next day onwards, ferrum phos 6x should be given as follow-up twice a day for 3 or 4 days. Zinc-Met, high fever, weakness, intolerance, slow and very mild action of centers that nourish the body, failure of indicated remedies to give result, slow and gradual progression towards unconscious stage, dull eyes and emaciation of the body indicate Zinc-Met. The patient moves his head this and that way continuously. Tongue dries up and appear like a dried piece of skin. Involuntary motion and urination occurs. One hand or one leg gets paralyzed. The patient screams aloud due to severe pains. When these symptoms are present, one dose of Zinc-Met 200C should be given as the remedy. Few hours after the remedy is given, the patient will have sudden jerk or shivering in the paralyzed parts and profuse sweating. In some other patients, 2 or 3 vomitings may result. This indicates that the remedy has worked. We should never change the remedy in this condition. From the next day onwards, ferrum phos 6x should be given as follow-up twice a day for 3 or 4 days. Swasti. Now we will start the new topic, sunstroke. Sunstroke or sunstroke-like symptoms result from working continuously near the machines that produce enormous heat, cooking at open mud-built stoves at noon in summer season, or roaming in severe hot summer till one gets exhausted. People affected by sunstroke will have the following symptoms. 1. Intense weakness, restlessness, blurred vision, feeble and slow pulse. Outer surface of the body will be cool. 2. High fever, temperature more than 104 degrees Fahrenheit. 3. Dehydration, irregular body temperature due to paralysis of thermoregularity center in brain, increased percentage of carbon in blood, increased blood supply to brain and lungs due to enlargement of pulmonary artery, undue blood clotting, congestion of lungs, damage to the right part of the heart, lungs congested with blood and very rigid, contraction of left ventricle. General symptoms of sunstroke. 1. The patient feels lazy and weak. He does not like to work. He suffers from loss of appetite and intense thirst, a reeling sensation, heaviness of chest and snoring. He sighs often. 2. Throat becomes dry and there is hoarseness. He suffers from throat pain while swallowing. Extremities of the body have numbness or burning sensation. 3. Bleeding from nose, redness of eyes and conjunctivitis, paleness of face, nausea and vomitings are also observed. There will be sudden onset of diarrhea. In some patients, constipation is present. 4. The patient gets confused to answer when inquired, gets unconscious and falls down. In some patients, nerves excite too much, muscles flex and even spinal cord gets paralyzed. 5. Because of increased carbon percentage in blood, face and skin turn blue or black. In some patients, there may be murmur in windpipe. 6. In some patients, pulse is very fast and irregular, while in some others, pulse is feeble and slow. 7. Body temperature may be subnormal or high above 104 degrees Fahrenheit. Ill effects of sunstroke: inability to bear sunlight, lack of sleep, reeling weakness, headache, and exposure to hot sun. Constipation, indigestion, liver troubles. Precautions when affected by sunstroke. 1. The patient should be moved from cool locations. 2. Face and vertebrum should be wet with lukewarm water. 3. Clothes should be loosened. Homeo medicines useful in treatment of sunstroke. 1. Gelsemium, shivering in body parts, weakness of muscles, reeling, headache in occiput, extension of pain from temples into ears, heaviness of eyelids, jerks in eye muscles, shivering chin, sensation of a splinter in throat indicate gelsemium. When these symptoms are present, 1 dose of gelsemium 200C should be given. From the next day onwards, natrum 3x should be given as the follow-up twice daily for 2 or 3 days. Aconite, if the following symptoms are produced in a person immediately after going out in hot sun, aconite is indicated. These symptoms include restlessness, fear, fullness of head, intense headache as if head will explode, aggravation of headache by shaking head, pale face, shivering of tongue tip when extended, skin having intense heat, and shivering of extremities when indicated. 1 dose of aconite 200C should be given as the remedy. From the next day onwards, natrum 3x should be given as the follow-up twice daily for 2 or 3 days. Antimonium crudum. The patient easily gets angry. He does not like to be seen or touched. There is white coated tongue, headache due to indigestion, lack of hunger, belching, itching inside the chest, and hoarseness of throat. When these symptoms are present, 1 dose of antimonium crudum 200C should be given as the remedy. If it is required, a second dose can be given in the same potency after 24 hours. From the next day onwards, kalium 3x should be given as the follow-up twice daily for 2 or 3 days. Arsenicum album, restlessness, anxiety, burning sensation all over the body, severe weakness, thirst for small quantities of water at short intervals, fear of death, headache relieved by cool application and aggravated by hot applications indicate Arsenicum album. The patient prefers to cover his entire body except head so that head is exposed to open air. He cannot lay down in bed constantly and rolls this way and that way. When the symptoms are present, 1 dose of Arsenicum album 200C should be given as the remedy. In general, there is no need to repeat this medicine. From the next day onwards, lecithin 3x should be given as the follow-up twice daily for 2 or 3 days. Swasti.